parking lot of the Women's Healthcare Clinic and vowed to institute an escorting program to protect patients. Thus, AZ Clinic Defense Force was born in 2016. A longtime volunteer and a nonprofit organizer, Serena has spearheaded campaigns and dominated media cycles for the Max Cure Foundation for Pediatric Cancer, Planned Parenthood, with the Human Rights Campaign, the world's largest LGBTQ advocacy organization. Nothing drives her more than breaking the cycle and the system of oppression already in place against those we need to uplift the most. I'm not going to go on. I'm going to let you meet Serena. Additionally, today is Serena's birthday.
Birthday to you. Happy birthday to you. Happy birthday, dear Serena. Happy birthday to you.
Thank you. Thank you to Ncjw, Carol, our brilliant panelists that are all throughout the room. Of course, Jody Liggett, who you will meet next, and all of you so much for being here. Most of you do not know me other than what's in your program and Carol's lovely words, but I'm going to let you in on a secret. I am your daughter. I am your granddaughter. I am your sister, your niece, your wife, your friend, and I might even be you. I was 18 when I had my daughter, and I was 19 when I got pregnant again and knew I couldn't do it over. Pulling into the parking lot of a Planned Parenthood, I was bombarded with graphic imagery of botched abortions. Signs damning me to an eternity of torture, men screaming, "Mommy, don't kill me," and someone threw a baby doll covered in fake blood at my face, all in the name of their God. I was terrified and alone. Feeling relief after my abortion procedure, as 95% of all patients do, I vowed to create a program dedicated to the safety and sanity of patients having to traverse a gauntlet of ill-informed sidewalk terrorists, and AZ Clinic Defense Force was born in 2016. We have 88 escorts currently on our roster, with another 20 plus coming to our next training session in 3 weeks. We escort 5 days a week, Wednesday through Sunday, at clinics in Tempe and Glendale, 2.5-hour shifts each day. We are comprised of diverse races and ethnicities, all genders, men, women, trans, and non-binary folks. We have mother and daughter teams, wife and their teenager teams, who come out to clinic as a family, and dozens of people a week stop by to give us thumbs up and high fives. They bring us donuts, coffees, and an unlimited supply of hugs and thank yous. One supporter even delivers frozen grapes, both green and purple in the summer. We get these thank yous from people who have had to make the scary and sometimes violent trek through protesters alone before us, or who are just driving by and see our efforts. We have done security and de-escalation at the March for Our Lives, rallies outside of ICE headquarters and the 4th Avenue Jail. We have stood against gun-toting hate groups at First Church UCC during the Religious Coalition for Reproductive Choice panel, with nothing but our vests, our umbrellas, and our love on a 115-degree day. We've kept those same right-wing, white supremacists out of candidate and elected officials' events, including Bernie Sanders. We have guarded thousands of folks at the Women's March, but our main priority is sexual and reproductive health care clinics, Planned Parenthood being the most targeted. The intersectionality of oppression is second to none in those parking lots, and wherever there is injustice, you will find us keeping hate at bay. Standing here in front of a room of religious reproductive rights advocates is a welcome respite from the zealotry we deal with at clinic. The men on the sidewalks use their book and perceived moral high ground to shame and degrade patients, going so far as to call every male-presenting person walking through our doors a coward, and every female-presenting person a murderer. No matter the health care they are receiving, HIV and STD testing or treatment, low-cost birth control, free condoms and sexual health education, HRT, hormone replacement therapy for transitioning patients, pap smears, the morning after pill, which is a misnomer because you can take it up to 5 days after an unprotected sexual encounter, and yes, absolutely, abortion services. I am very proud to be a Planned Parenthood volunteer leader, the founder of AZ Clinic Defense Force, a mother, a granddaughter, a friend, aunt, wife, and here with all of you today, accepting the impact award. I could not have done this alone, though. Please join me in thanking a few of our escorts who are lunching with us today. They absorb the hate and vitriol of anti-choicers and give nothing but love to patients and companions. They are the heroes, and I am but their humble servant, hoping to make the world a better place through mutual aid, personal connections, and this escorting program, which I hope someday we will get to a point that we don't need it anymore. No one should be shamed for their healthcare choices. And with groups like Ncjw making waves for reproductive justice, freedom, and rights, standing firm against religious supremacists trying to control people's lives, and lifting up people like myself who are impacting this work, we may one day get to a place where our bodies, our lives is commonplace, the new normal, and we may live peacefully in our own bodies knowing we have full autonomy. Thank you so much for recognizing what one person can do. Each and every patient I have given transportation to, held their hand, been screamed at by, hugged, handed tissues to, been thrown up on, cried with, or done nothing but walk 30 seconds to the door has touched me in a way that I will forever be grateful. I wish I had me when I was terminating my second pregnancy. To my grandmother, for being my constant strength, my best friend for getting me through this crazy thing called life, my brother and sister for laughing and loving, my husband, words, and to all of my fellow escorts. You have given me more than you will ever know. This program has grown a large family of very unique people who are the only ones that understand this work and what it truly is. Love. Unashamed, unabashed, impactful love. This is for you. This is for us. And this is for every person who has ever been told they weren't worthy of their own decision making. Thank you all very, very much.
How do you follow that? For some of you that may remember Holly Near, a folk singer in the 70s, she had a song that started with, "Something happens to me when I witness someone's courage." And that's happening to me right now as I witness Serena. Aww. Thank you. the 2016 elections, we learned that our reproductive health care rights could be dismantled at a rapid pace, and that legal abortion and birth control could actually disappear, and that the idea that legal abortion and birth control could actually disappear became a harsh reality. This past year, the National Council of Jewish Women, Ncjw Arizona section, focused our programming and our action on reproductive health care and bodily autonomy. This afternoon is the culmination of that effort. Our esteemed panel will help us understand why we are living in what Planned Parenthood described as a state of emergency. This afternoon we will explore the direct correlation between reproductive restrictions in all its many forms on our health and the health and safety of our families. Why more women in our country are dying during childbirth and shortly after than in any other country in the developed world, when 85% of these deaths could have been prevented. The consequences of restrictive birthing protocols in largely Catholic hospitals, where religious doctrine dictates medical practices, and the lack of mandatory evaluations of best practice birthing in all hospitals. Why access to contraception and family planning clinics are drying up, and what the public health consequences are. Why pregnant women are turning into criminals, and what we know about legislative initiatives and how the medical community is fighting back. We are fortunate to have an extremely knowledgeable and informed moderator to help guide us through this discussion. Jody Liggett graduated from the Sandra Day O'Connor College of Law at ASU. She served as CEO for the Arizona Foundation of Women. She was senior policy advisor for then Mayor Greg Stanton. Currently, she's vice president of external affairs for Planned Parenthood Arizona and the executive director of Planned Parenthood Advocates of Arizona. Please give a warm welcome to a dear friend of NCJW and an admired advocate, Jody Liggett.
Good afternoon, everybody. I think this is the second time that I've had to follow Serena. And I want you all to know I do not appreciate it. Actually, it's quite an honor. Thank you very much. I would invite my fellow panelists to join me up here on stage while I cover just a little bit of housekeeping initially. As was mentioned, my name is Jody Liggett. I work for Planned Parenthood here locally. I run our advocacy and outreach on our 501c3 side, nonprofit side that operates healthcare clinics. And I run our political operation, which participates in direct fight back advocacy and also in elections. We've found that necessary to protect our patients and our ability to provide care. What I'm going to do is introduce you to each one of our panelists, tell you a little bit about them, what they plan to cover. We won't be taking questions as they speak. We'll hold our questions till the end. So we'll run through the entire panel. After I introduce everyone, I'll guide us along, and I think we have a timekeeper somewhere. Yes. And then we'll take questions from you all. You have note cards on your table. If something springs to mind, be sure to write it down. Folks will get those to me, and then during our discussion time, we'll be able to have a really good back and forth with the audience. So I do have to tell you that we are, in fact, in a state of emergency in Arizona. Some of the most draconian regulations in the country have been passed in the last 5 to 10 years in Arizona, which regulate our clinics and people's ability to access our clinics. Truly, Arizona is a laboratory for this kind of thing, for trap laws, which are targeted restrictions of abortion clinics. So what do we do about this? How do we combat it? To combat it, we have to understand the various dimensions, and I think kind of how we got here over the last 30 years, and that's what our panel is going to help us understand. What the windows of opportunity are right now, what are the threats on the horizon, and what can we as everyday people do to protect our brothers and sisters who need our care and who do not need to feel judged for accessing our care. So first, I want you to join me in welcoming Bree Thomas, my colleague, who is the Chief Executive Officer of Arizona Family Health Partnership. Bree brings to the Arizona Family Health Partnership more than 25 years of leadership and experience working with nonprofits in Arizona. Bree served as a dedicated member of the Board of Directors for 6 years and as president of the board from 2008 to 2010 before assuming her responsibilities as CEO. Bree will be discussing contraceptive deserts. Just like food deserts, we have contraceptive deserts in Arizona and across the country, abortion wastelands, the closure of family planning clinics, and the public health consequences of that. Next, we have Ncjw, who is a television journalist, documentary filmmaker, and former television news executive at CNN. She produced the independent and cable documentaries, including 2017's Birthright, A War Story. And Ncjw will be discussing with us the criminalization of pregnancy in this country and the threat that places before our patients. We also have Dr. Julie Quatra with us. Dr. Quatra is a graduate of Duke University and the Ohio State University. She completed her residency in obstetrics and gynecology at St. Joseph's Hospital. In 1999, her special area of interest includes high-risk obstetrics and surgery and minimally invasive surgery. She's quite an expert. She served on the board of directors for Aid to Adoption of Special Kids for 10 years and is currently the legislative chair of ACOG. Well, we skipped over Dr. Linda. Sorry about that. Dr. Linda Chambliss is director of the Division of Maternal Fetal Medicine at St. Joseph's Hospital and Medical Center. Dr. Chambliss graduated from Duke with a BSN degree. After graduation, she worked as a registered nurse. She is a nationally recognized expert in the impact of social factors on health and has been a guest on Oprah discussing the impact of domestic violence in American society. So we have quite a panel today. I'm going to kick it off by hearing from Bree Thomas, help us understand abortion deserts and family practice or family contraception wastelands.
Absolutely. Thank you, everybody. I first just want to say thank you to all of you gathered here today. Jody and I were talking about how we are so grateful that you're willing to have these conversations and that you're willing to learn more and understand kind of the work that we're doing, because as we sit down and looked at one another today, we're like, how are you? We're exhausted. I'll tell you that right now. I mean, I'm speaking for myself. I'm not sure I'm speaking for Jody. Exhausted is about the best word I have for how I'm doing. I think we will continue this work, and after following sort of the presentation from you all and seeing you all standing up in support of the work that the escorts are doing brought tears to my eyes. So thank you for your work, and thank you for doing that. I probably won't talk as much about abortion deserts, mostly because the Title X program doesn't fund abortion work, but I want to talk a lot about family planning and reproductive health, because that is what we do. Fun? Unless they do. There will be other panel members that can absolutely address that, and I can talk a little bit about it. I'm sure you all are aware that 50% of all pregnancies are unintended. So just kind of let that sink in. And Medicaid pays for 50% of all pregnancies in Arizona. So access to reproductive health care is really important. And here in Arizona, can always be a little controversial, shall we say. And just when you think, if you're not pro-choice or you're not available terminations or abortion, you should be absolutely pro access to reproductive health care, because the best way to prevent an unintended pregnancy is abstinence or access to reproductive health care. And we're having a hard time winning that battle here, even in Arizona. So just a little bit of background about Title X, because the Arizona Family Health Partnership is the nonprofit agency that writes for and is awarded most of the Arizona Title X grant in Arizona. I have never evoked the name of Richard Nixon as much as I have in the last 18 months. But Richard Nixon signed this into law in 1970 as an anti-poverty initiative. It is the only federal law that prescribes dollars in funding for family planning services. It was shepherded through Congress by George Herbert Walker Bush. It was a bipartisan effort back when there were bipartisan leaders in this country. And it was to increase access to family planning services for women without regard to economic status. So that's important. Title X services, the services that we provide are comprehensive services and supplies. There's a priority for low income, so that means below 100% of the federal poverty. For folks between 101 and 250% of the federal poverty, it's a sliding fee scale, so depending on the clinic that you're going to will determine how much you pay, but it's pretty nominal. Services are never denied on base of ability to pay. So even if you have an insurance card but you have access to no money, we can provide your services for free. If you don't have an insurance card, we can provide you services for free or no cost. And it also includes education and outreach. So it's a little more flexible, I have to say, than Medicaid dollars. We're able to pay for things that Medicaid might not be able to, like counseling services, like an exam table, like additional education outreach materials. So depending on what the providers need is what we're able to, in the reproductive health arena, able to provide. Currently, and I say that currently because we all know that there may be some changes coming down the pike, and I'll talk a little bit about them in a minute. But right now, all services are voluntary. We encourage parental involvement, but it's not required, so teens may also receive services as well. They're confidential. They're confidential from spouses, from moms, from sisters, from brothers. They're confidential for everybody, for teens and adults. We focus on the low income. Informed consent is through neutral and factual. It's also really important right now. Counseling. Our accountability is based on some of the data collection that we do, both client seen and financial pieces. You may not use Title X funding for abortion services, but we are required by law to provide counseling to folks that are, or women in particular, that are unaware of their options when they receive a positive pregnancy test, which means we talk about keeping and what that might be. We talk about termination, and we talk about adoption. And while we don't actually see clients, we fund clinics to see clients. We fund Planned Parenthood. And that's where we kind of get in the crosshairs, in the sense that we're proud partners with Planned Parenthood. We appreciate the work they do. I have to tell you, they are stellar in the areas of reproductive health care in terms of quality, client seen, in terms of the care that they give with cultural competency. And so we are proud to work with them. We also fund county health departments and community health centers across the state. And we're not in every state, so this is where, or in every county, so this is where we talk about some contraceptive deserts. And even though we are in Coconino County, we're in one city in Coconino County, and Coconino County is a rather large county. So people have to drive long distances oftentimes to be able to receive services. If we were to use the Title X $5.4 million a year just in Maricopa County, we wouldn't even meet the need of Maricopa County. So there's not enough funding for Maricopa County, let alone the whole state. So I'm trying to hustle here a little bit because I know we have time limits. For every dollar spent with this federal funding from Title X, nationally we save about $7.09 for the Medicaid system across the country. In Arizona, that's $11.27. So for every dollar of family planning, we saved $11.27, which was $61 million in 2016. That's because birth and complications from birth and maternal care is a little expensive, as you might all know. Healthcare is. Prevention, kind of that public health piece that is so important, is what we try to focus on as well. I'm going to talk to you. I don't have, because again, we don't see clients. Our clinics see the clients. I don't have examples in terms of patients. What I have is examples in policy. And so I'm going to talk a little bit about at the federal level and the state level about policies that have either been impacted in the last 18 months or are going to be rearing their lovely, scary heads in the next couple months. So over the last 7 years, the U.S. House of Representatives has zeroed out funding for Title X services. The United States Senate over those same years has always provided us level funding, so we've been safe in that sense. But things I think are going to change in terms of the U.S. House of Representatives on day one. We've got this great new crowd of young supporters there. Moved to remove the Mexico City, the international gag rule on day one, while the U.S. Senate on that same day wanted to make permanent the Hyde Amendment, and the Hyde Amendment means no federal dollars for family planning, or for professional services, sorry. So I think we'll have to watch there. I think that was just the beginning, and I think the shutdown kind of stymied some things, but we're going to see a rash of this back and forth coming, I think, on all angles. So this is where the bulk of my stress has come from for the last 6 months. The Health and Human Services Department has done some draconian changes that you might not hear about because, well, there's a lot going on. And one of the things is they've changed their strategic plan. And in that strategic plan, they removed all references to LGBTQ individuals. They are dedicated to protecting the life from conception to birth, or to death, excuse me. The political appointees, yeah, exactly. It wasn't really a slip, was it? The political appointees really don't want to fund the Title X services. What they want to fund is abstinence only and crisis and pregnancy centers. So they've tried to morph our family planning system into a system we aren't. And so we've been doing, back ends to try to fit into there to compete with the people that they want to fund. They ended our Title X grants early. We got a new funding announcement in early 2018 that was pretty draconian, and AFHP was a declarant in a lawsuit against the federal government on that case, and that's still working its way through the appellate system. We were funded for 7 months and not 3 years, so then we were competitive again, which we just submitted in January, and at the same time, this Office of Population Affairs at HHS wanted to post our award-winning, their words, not mine, our award-winning grant online for all to copy, my word, not theirs, in this kind of competition. So let me just say really quickly, there's rulemaking that will come out in the next couple of days that will also remove things like medically accurate, that will remove references to long-acting reversible contraceptives, that removes hormonal contraceptives, but talks a lot about fertility-based awareness methods as well as natural family planning. So one last set of examples is here in Arizona. I just want to talk to you. In 2012, they passed a law, a tiering law, that basically said if the state gets any Title X family planning dollars, they may not fund any abortion providers, and they have to go through this, rural health, community health centers. They've listed out how they can be funded. So in 2017, they mandated that ADHS apply for this grant. And so ADHS did apply for this grant and received 25% of it. So they've received $1.3 million, have yet to see a single client since September. We've seen probably almost half of our clients by now. And that's for 7% of the population. So they got 5 counties that they could work in. They put it out an RFP, and so we're waiting to see who is willing to respond to that. So it's not just about abortion, it's about family planning, and they're attacking it in the 211 system. There are some new interesting laws or bills that have come up that we're trying to get our handle on, so I know my time is up, but I wanted just to let you know that, again, it isn't just about abortion services, it's also family planning.
as Bree said, for years in Arizona, you hear about the high-profile stuff, but the governor and the folks who work for him, and now the president and the folks who work for him, operating at this very granular bureaucratic level, right, to obstruct access to the one thing that is proven to reduce the need for abortion, birth control. I don't know when our